Hello again, everyone. My name is Deawodi Ladzekpo. Now, let's jump into part 2 of this case and reveal the diagnosis. On arrival on the acute care floor, the patient's mental status declined and he became less interactive. His vital signs were temperature of 37.2 degrees Celsius, respiratory rate of 40, heart rate of 155, blood pressure of 123/90, and a blood gas demonstrated a metabolic acidosis. Before we get to the final diagnosis, here are some of the differentials considered by the floor team on admission given the history. Viral URI, sepsis, heart failure, laryngomalacia, tracheomalacia, diabetic ketoacidosis, inborn errors of metabolism, non-organic failure to thrive. This patient was diagnosed with diabetic ketoacidosis in the setting of neonatal diabetes. The patient's blood gas was found to be 6.8, 20, -30, with a blood glucose of 676. A medical response team was called, the patient was admitted to the PICU, and the endocrine service was consulted. He was started on an insulin drip. Neonatal diabetes, also called congenital diabetes or diabetes of infancy, often occurs in infants who are younger than 6 months of age, but can also occur until 12 months of age. This is typically a monogenic disorder, and it is characterized by 3 different forms: permanent, transient, and syndromic forms. These patients often present in the setting of recent illness or sepsis. Neonates with significant hyperglycemia, specifically blood glucoses greater than 250, are often later diagnosed with neonatal diabetes. This diagnosis should also be considered in patients with a history of low birth weight, prematurity, and who do not gain weight well. In addition, the workup for these patients should include a blood gas, urine ketones, serum glucose, C-peptide, and insulin levels. After the appropriate treatment was begun, his blood gas normalized. He was discharged a few days later on insulin. The patient is now doing well. Genetic testing was done and he was found to have an autosomal dominant monogenic cause of his neonatal diabetes. His neonatal diabetes was found to be the permanent type. He was discharged initially on insulin. He was later switched to glyburide, a sulfonylurea, to manage his diabetes, as it is the best medication to treat his type of neonatal diabetes. Here on this slide, you can see his blood sugar when he was on insulin and after he started this sulfonylurea. And this is his current growth chart as of May of this year. As you can see, he is back on track and gaining weight appropriately. Thank you so much for taking time to listen to this presentation. I hope you learned something.